Lake Regional Health System was built to deliver exceptional care. Our expanding team renews this commitment every day and will continue this commitment for generations to come. We consider it a privilege to offer our ever-expanding capabilities to our friends and neighbors in mid-Missouri. From comprehensive orthopedic care to 24/7 heart attack response and our nationally accredited cancer center, we continue to strive to meet the growing needs of this shared community. One of the areas of healthcare that we continue expanding is diagnostic imaging. Whether it's a 20-week anatomy scan in our family birth center or a life-saving echocardiogram in the emergency department, our healthcare professionals at Lake Regional depend on diagnostic imaging to diagnose illnesses and injuries, monitor treatment, and screen for diseases. Did you know that ultrasounds are performed in multiple areas of healthcare and take images of all areas of the body? My name is Mandy Bargfried, and I'm the radiology manager here at Lake Regional Health System. Following high school, I went to Iowa Central Community College, where I entered into the radiography program. While I was there, I also had scholarship to play basketball and softball. So I attended classes and practices and games. My husband and I decided to move to Lake of the Ozarks. I applied for a position here at Lake Regional, and I started off just a PRN employee working as needed, and that moved into a full-time position working the night shift. Over the course of my 17 years with Lake Regional, I've been able to cross-train in several different areas of our health system, including mammography, CT, bone density, our cardiac cath lab, and now I'm in management. Diagnostic imaging provides many career opportunities within healthcare. This is Laura. As a sonographer, she performs ultrasounds throughout the health system. Take a closer look as she performs a 20-week anatomy scan at Lake Regional Family Birth Center.
So here's baby right here. You can see baby's heartbeat, and then here's baby's spine going across the top of the screen. Aortic arch right here coming all the way down through baby. Baby is in the breech position, so head is up here, bottom down here, and baby is facing your spine. There at the bottom, there's baby's feet. Right there, did you see it move, kick? So there's toes. And then heels right there, and then other foot is there too. So there's both arms. Hands are up together by the face right there. And then there's the start of baby's face, front on. We evaluate all of baby's anatomy, so making sure baby has 10 fingers and 10 toes, heart looks good. We look at the brain and the brain structures. We do measurements of baby to make sure that baby's measuring right with what your due date will be. We evaluate placenta and then the uterus as a whole. We also evaluate the umbilical cord. We watch it going into baby, and you can see it here going around the bladder. We look at it going into the placenta as well. We can see what baby's heart rate is. Got baby's heart rate at 158. So here I'm measuring baby's head. That's one of 3 measurements that we do to evaluate baby's weight. I'll measure the abdomen as well. And then we measure the femur too. So that is baby's femur right there. I love the variety of ultrasound. I don't do the same thing every day. There's all different types of exams that I can do, from OB, vascular, general ultrasound looking at livers and gallbladders. Every day is different. I thought I was going to be a physical therapist until I job shadowed, and then realized that wasn't for me.
Ultrasound is used in several departments throughout the health system, not just in pregnancies. Diagnostic imaging plays an important role in providing time-critical care for trauma, stroke, and heart attack patients. This is John. His patient just came through the emergency department after a cardiac event. He is going to perform an ultrasound of the heart to help our physicians diagnose and treat the patient.
This is one of the first views we look at to assess the heart. You can see the function of the heart muscle squeezing in toward my finger. You have a valve in view here that is opening and closing, you can see. We can assess and track red blood cells through the valve and the chambers with this color. It's called color flow Doppler. similar to what's used in weather radar when they're giving you a weather map. Currently, we're measuring the volume of her left ventricle to assess her cardiac function and output. We do these measurements to allow the doctor to come up with conclusions on overall function of the muscle of the heart, its ability to pump and supply blood to the body. That sound you're hearing, of course, is the cardiac cycle. What we're looking at here is the left ventricle, the muscle. We're actually looking through it as if we had a Coke bottle in front of our face, and we're going through it in different segments as we drink the Coke.
Having athletics be such a large part of my life, I had some amazing coaches that really left an impression on me, and now as manager I get to channel that coaching energy into developing the next generation of diagnostic imaging professionals.
My name is Megan. I am the sonographer at the Lake Regional campus in Lebanon. I went to X-ray school at Missouri Southern State University. When I was trying to decide what I wanted to do as a career, I started job shadowing. I actually got to job shadow with my now office manager, Mandy, and she got me on the path to X-ray at Lake Regional. They asked me to become a sonographer, and that was really the only modality outside of X-ray that I had interest in for myself. So I agreed. I went to Washburn University. It was a 2-year program. There's so many credentials that you can have after your name. There's so many registries that ultrasound can take. When you work in diagnostic imaging, whether you are in ultrasound, you're in X-ray, you're in MRI, no body is the same body. So literally every day is something different. I would encourage that anybody in high school looking for a career path that suits them to job shadow. Always job shadow, always ask questions, always do your own research. Whenever you're in a program, ask your professor if you can choose the place that you do your clinicals at. If that's somewhere that you would potentially like to work, that can get you a foot in the door. It's always good to do your clinical somewhere that you would like to work, because you already know the machines, you already know the equipment, you already know the people, and they know you. For 2 years, from day one to the day I graduated, I did all of my clinicals at Lake Regional.
My name's Ethan Kusick. I'm a second-year X-ray student at East Central College in Rowell, Missouri. During my first year of college, I had no idea what I wanted to do, so I job shadowed a bunch of different fields. While job shadowing in radiology, I realized that this is something that I could definitely do every day. I currently work at Lake Regional as a student tech in the radiology department. I work side by side with registered techs, and they help me learn daily. Something that's awesome about this field to me personally is that once you get out of X-ray school, there's so many different directions you can go. I plan to learn CT. In May, I will graduate with my Associates of Applied Science in Radiography. Because I am currently working as a student tech, Lake Regional has offered me a full-time position in May when I graduate. I'll be working as a CT tech in training in that modality. If any of you have interest in this at all, the first thing I would do is job shadow. This will really show you if it's something that you want to do. I mean, you might get in there and think, oh man, I would never want to do this, but that would be the first step. I'm super pumped with my career choice and how it's been so far, and I'm very excited for my future in radiology.
At Lake Regional, we want to be a resource for students who are interested in learning more about diagnostic imaging careers. Students could witness our team in action by applying to become a junior volunteer or to job shadow. We hope that someday you'll join our knowledgeable, dedicated team of people who care for patients and each other at Lake Regional Health System. Our commitment runs deep.